believe it was just, Sue Akins has a procedure book. It's basically, go to the procedure book for each medical question, I guess you could say. So there really was no changes to this policy.
Move approval.
Second.
Any more discussion? All in favor?
Aye.
Aye, opposed? 500. Next.
Cleaning up spill of body fluids. We just made some, just kind of cleaned up the language a little bit on this. Under number 6, what we changed in the writing was always wash hands with soap and water after any contact.
That's new language completely?
It was new language. Prior to that, it was.
I think
Is it just the
It mentions something about it to.
Always.
Yeah, the wording was off. The wording was just off.
Okay.
It was pretty common sense. We deleted the last sentence in number 6, though, because it stated soap and water will kill HIV. We felt that was misleading and got rid of it. And I think the other one was the word Massachusetts at the bottom was missing the letter C, so we just added that. And there was a deletion at the very end that spoke about pregnant women. We just didn't feel that we needed to specify a pregnancy. It was kind of redundant. So it was more all grammatical changes that were made on that.
Any discussion?
Mr. Chairman?
Kenny?
The words that are bolded, are those changes, or is that just the way this
No,
appeared?
that's all it. That's
all universal precautions. Are those changes?
No.
No.
They are just
the way.
highlighted.
Right.
Jeff?
Number 5 currently reads, all disposable materials, including gloves, must be discarded in a sealed plastic bag and immediately taken to a dumpster. I have a big problem with that. All body fluids, I think, have to be treated as infectious waste. I assure you, a hospital and a healthcare facility does. There is no way infectious waste should be disposed of, whether in a sealed plastic bag or not, in a dumpster. Now, the truth is, because it's unenforceable, that's exactly what happens at a private home. But the law can't enforce what happens at a private home. But at a school, I'm sure there are regulations that say infectious waste can't be put into a dumpster, because what goes into a dumpster can be taken out of a dumpster.
I actually mentioned that one, and there isn't. I asked to.
When a nurse is treating a student, is there any provision for infectious waste disposal?
I don't know. Mr. Chairman, through you, my question is, can you please tell me then where are you going to put this?
Well, that's because at a healthcare institution, there's infectious waste, and it's picked up and disposed of as infectious waste, which almost always means incineration. So my question to our superintendent is, if this occurs at one of our schools, does the school nurse have the capacity to dispose of infectious waste appropriately, or is it just thrown in the garbage?
It is thrown in the garbage. It is thrown in the garbage into dumpsters that are locked, that do go to CMAS, that do get incinerated. So the dumpsters are locked up. They're not accessible to people to go dig through.
That was one of the questions asked at the policy review.
So
A locked dumpster that
And we
gets
had 2
incinerated.
nurses there to report about practice.
So it doesn't go into a landfill, it gets
no, it goes to
incinerated.
CMAS and it's incinerated.
And that's the law.
That is what they tell me is accepted procedures according to school nursing.
Who is they?
The nurses.
The nurses.
Mrs. Akins was there, and so wasn't another nurse from another school.
Ken?
well, maybe we need to look into it a little further instead of just keeping the bodily fluids in the cafeteria or something. We can't put them out in the dumpster. Hospitals and them have bins and things where that stuff is disposed of and it's picked up by a hazmat or whatever the company is. So the school probably should follow those same type of safety procedures, other than throwing it, to Jeff's point, in a dumpster. But in the meantime, I would say that that is the safest way right now, other than leaving it lying around somewhere within the school. So until we can find out, maybe through talks with the hospital, how that is handled, maybe that's something that we need to look at, having someone in the medical profession come by and pick this up.
Mr. Chairman, I agree with Kenny. Even if it goes into a locked dumpster, which is nice, there's a period of time where it sits somewhere until it goes to the locked dumpster. And if it's not segregated as infectious waste, then it means our children and staff are exposed to it, whether it's in a theoretically sealed plastic bag or not. Now, having said all that, I don't know what the regulations are. These aren't healthcare institutions, which is where my expertise is. So if the regulations ignore the hazard associated with this that I see, then they ignore the hazard and we're doing what's appropriate. But I would like some comfort that the regulations specifically say that infectious waste can be handled the way we're handling it.
Mr. Chairman, if you wish, we can look at the regulations and call the appropriate people.
You have something to add to this conversation?
At one point,
Go ahead.
I know that at the school level, the school nurses have, it's the circular hands that with the pedal with your foot, so they're not touching. And every school nurse's office, that's basically where, if a child were to vomit, if a child were to get sick, that it's contained in a sealed container within the
But eventually that sealed container is emptied by a custodian who brings it out to the dumpster.
It's bagged, it's already in a bag.
What's your pleasure, ladies and gentlemen?
But the custodians are also practicing. I mean, they're not running around. They got their gloves, and they know.
Through you, Mr. Chair, I think that it's appropriate for the superintendent to go and to investigate this a little bit more with the school nurses, see what the policy is, or not the policy, but to see if there's more, more that can be done. Because they do have a separate book that we're going to be going through here, the emergency health procedures, that has many of the procedures, not just the policy. But we'll see if any changes need to be made to this. But instead of this going back to the policy review committee, I think that we should probably just get a response back from the superintendent.
I will investigate and put back.
All right, let's just not take any action on this tonight. Anyone opposed to that?
No.
All right,
No.
next.
Measuring body mass index, which is that new, another wonderful state regulation. I'm sorry. So which policy, we had a policy, this was, Rhonda, correct me. We made changes to this policy, but it wasn't a policy we had.
No, this is a new policy that came to
So
us
this is all just new.
from the superintendent because of the new legislation that came down. We debated for a while on whether we even needed this, because there are other things that have come down from the state where we didn't need it, but we felt that this was important to have because of the parents. There's going to be a lot of questions about this. So not only did we want to make sure that there was a policy in place of how this would be done and what parents could do, but then also around the communication of it. So we actually did get to review communication that's going to go out to parents. We had an opportunity to make comments to that. So there was debate whether to even have this policy or not, but based on the sensitivity of this new legislation that's come down, we thought it was appropriate to have a policy in place, in case there were any questions from parents.
Thank you. Just one question to anyone that wants to answer it. What is the implementation date for this new law?
It has to be implemented by the end of the year.
By the end of this year?
Yes.
School year?
Yes.
Any other discussion?
Just for clarification
Yeah, go ahead.
on that answer, does that mean we have to have measured all of the first, fourth, seventh, and 10th graders by the end of this year, or that we can begin measuring at next year?
By June 30th, 2011, it has to be implemented. Now,
That means,
weighing children and measuring their height has been occurring for the last 20 years as part of public health regulations. The only difference is that we now need to feed those numbers into the calculator and come up with BMI, and then to send a prescribed letter to parents with that information. And the last paragraph, the first paragraph is the law, the second paragraph is where it tells you how we will do it, and in the back of the form is the letter that was going home to parents to tell them about this.
I missed that.
And then the handout is for, there's like a mailing
Yes,
pamphlet that goes,
Yeah.
that goes to the home.
right.
Mr. Chairman?
Yes.
Is this, I have zero interest in the individual data that this will generate, meaning on each and any given student. But is this data going to be aggregated so that we could, for example, calculate the average median BMI for our first, fourth, seventh, and 10th graders?
Can it, if the question, Mr. Chair,
Yeah, go ahead.
it can be, yes.
Because it seems to me that those 4 grades represent about 1,000 children, plus or minus, roughly. That would create some very robust data. And of course, the first time we get it, we're not sure what it means. It's a baseline, if you will, of data. But if we saw, for example, that over a period of, say, 5 years, that BMI for, the average BMI for our system was getting lower versus getting higher, et cetera, that would tell us something about the physical education programs that we have in our schools. It's an indicator. It's not a perfect indicator for a lot of reasons. It doesn't, as usual, there are a lot of other factors. But I, for one, think it's an indicator of the physical education programs that we have. And I would like it aggregated.
Anyone else?
That was popular.
To be quite honest, I have a multitude of problems with this. I had a multitude of problems when it came out. I just think that this is over the top. I understand about obesity. I understand about nutrition. I understand about physical fitness. I understand about getting them off the couch. I understand about getting them active. But from where I'm sitting, we're basically, in a place that I don't really think that we need to be in terms of public schools. I don't like it. I think it's invasive. I think it's Big Brother's watching, and if we have to implement it, we have to implement it. But I hate everything about it, and I hate everything about it. In fact, to label kids, to put another stigma on them, to put another stigma on parents, to even to draw conclusions on our curriculum, whether or not our curriculum is doing the job based on body mass index. So I just hate it, and I know there's nothing I can do about it, but I just hate it.